My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today we have the great pleasure of our wonderful repeat guest, Dr. Angie Smith. Angie, introduce yourself to the audience in case they haven't heard from you.
Yeah, hi Phil. It's Angie Smith. I'm a urologist at UNC Chapel Hill. I'm a urologic oncologist. And as you know, and hopefully the guests will at least figure out if they haven't heard from me before, I'm really a big proponent of work-life integration and really thinking through the choices we make and what we do to improve our lives in medicine. So it's really wonderful to be here, and I'm really looking forward to our conversation today.
Well, good. Well, we're glad to have you, and you're definitely one of the fan favorites as we look through how the podcast is doing. So I think everyone appreciates your really practical advice. And today we'll get into the practical, but we're going to start with a little bit of the abstract and talking a little bit about concepts of control, self-control. So why don't you get us started? Talk to us about how kind of concepts of control work in our everyday lives to our advantage or disadvantage.
Yeah, first of all, I just love this topic about control because, we're all surgeons, and what surgeon doesn't like control? I think that's part and parcel of why we choose surgery. We like to be able to control an outcome, and what better way to use a knife to do that? I think that what can be challenging with control is that the reality is we don't actually have it. We can try to set up our circumstances such that we feel like we have more control. But in the truth of the matter is that, on a very high level, the only thing we actually have control over is our actions, what we choose to do, how we choose to respond. But everything outside of that is actually outside of our control. And it's hard to accept that. But I think, in the conversation we have today, we can talk a little bit about some specifics about how we feel about control, what we can do to control that one thing we can, which is ourselves, and then how it all works together. Because I do think that the idea of control is really important to how we live our lives. Oftentimes, like how happy we are, how unhappy we are, a lot of the emotions we feel really leads back to that sense of control.
Yeah, and I think it's just a great opportunity to bring in kind of some of our philosophy on this and kind of what some of the philosophical literature says. I think it was Nietzsche or one of the great kind of Western philosophers that he was making an argument why we don't have free will. And I don't necessarily agree with that sentiment, but the argument that there are so many variables in our life and in everything we do that it's impossible to think we can control all of them, and kind of and that certainly influences our next steps or what we're actually doing moment to moment. And part of the Buddhist or Eastern philosophy is giving up that sense of control or that desire for control, and understanding that everything's going to change, everything's fluid, and this is a part of who we are and a part of how we exist. And I think that's, I think very appropriate to what we're going to talk about today.
Absolutely. I completely agree. And, it's a topic that we can probably talk about for, endless amount of time, but I think having some specifics can hopefully leave listeners with something to take away and to apply. And I always say, whenever we have these kinds of conversations, it's all about experimentation and how, the topic lands for you. it might land differently today than it will 5, 10 years from now. But kind of coming back and revisiting the thoughts, I think really at least have served me well.
Yeah. So let's start with really concrete. Let's start in the operating room. Control and out of control. And, how do you think about, the operating room and being a surgeon?
Yeah, it's funny. I forgot we were talking about control until this morning, and but yesterday I was in the operating room and I was talking about control with my team, and I was also thinking about it because I had a really challenging case, and I don't know. I'm sure many of the listeners have been there where you're like, I hope that I can actually finish the job here today, and and it's a scary thought. It's that feeling of lack of control that sort of creeps into your mind whenever a case is very challenging. What I was talking about with my team is that even though, and I like to actually communicate how I'm feeling. I think it's healthy. It's healthy for me. I think it's healthy for them to hear. But I told them, I was like, yeah, this is challenging. This is hard, and I told them, when I feel that way, I often tell myself a couple things. One, I felt this way before and I was able to get through it. That's helpful. And the second thing is that when I'm feeling this way, I often like to check my own emotions and remember that staying positive has served me well in the past. And so so it was actually, despite all of its challenges, I had a pretty fun day. And I would say like the rest of the team did too. We, have conversations. We, communicate how we're feeling. We try to bring in any kind of levity to the situation. That's where the control lies. I could have chosen, and I have in the past, I'll be honest with you, I could have chosen to focus on the negative, to focus on the fact that this case was going longer. Several aspects of the case were more challenging than I expected. But rather than do that, I chose to have more of a levity to the OR atmosphere. I think that kept everyone feeling more positive, more optimistic, and I felt better in the end. And it goes back to what you can do for your own response. You cannot, we've talked about this before, Phil, but I cannot choose to have some levity in the OR and then ensure that everyone's feeling good too. Never gonna have that control, but I can do it for myself. And so if you come from a choice of doing these things to make yourself feel better, I honestly think the rest of it kind of comes, and it might not, but in the end, it's all about how you're feeling. So I think that, again, this is high level, but in the OR, I try to create that atmosphere. Why? Because it makes me feel better. And if I feel better, I tend to have a better OR experience, and most people around me have a better experience too.
Yeah, I think that's a great point. You have no control whether you're a nurse or your scrub tech or your assistants or whoever it may be, how they're feeling, what's going on in their life. But by setting the tone, setting the example, setting the intention, to use a mindfulness terms of positivity and laughter, as you said, when appropriate,
Yep.
it really does set the tone, and it makes it okay for other people to feel that way too. So it certainly imparts that sense of control.
And then I want to actually add, Phil, because I mean, probably listeners are thinking, okay, well, great atmosphere, but what about like the nitty gritty, but I want to be more specific on those types of things. So I do think about a lot of that. And over time, I've changed what I've done to impart that feeling of control that I know reduces my anxiety. So a couple things I do. One, we know, I think a lot of hospitals right now, there are more traveling nurses. You don't always have the same team like we did. It was a luxury. I see that now. And so I decided I could be frustrated with that. And I was frustrated for a long time. Like I just didn't know. Sometimes I would have to reinvent the wheel. Okay, we're doing a cystectomy here. I have to go through everything again. But then I said, you know what? I could also just take some matters into my own hands here. And so I created a habit now. I come a little earlier. It's not very much, maybe 5 to 10 minutes early. I always go into that OR. You kind of meet the patient. I always have that habit. I've had that for years. I like to see them, talk to them beforehand. It helps them feel confident. It helps me feel good too. But then I added on, I go into the, to the actual OR. Sometimes, maybe people do that already. I wasn't doing that, at least not before the first time out, but now I do. And I go through the card. I walk through steps. It sets a tone. That's the best thing about it. I think actually it sets the tone, like I'm happy, they're happy. Like, here we are. What's your name? We do it even before the, time out, before the patient walks in the room. I get like pumped for the day. So it's good for me. It's good for them because they have that opportunity to ask questions before everyone's in the room. So that is a piece that has been vital. Even if it's someone I already know and it is my team, I love seeing them. It just sets that tone. And then they always have a question. They're like, in this case, like this other case I was doing yesterday was unusual. It was a standard case, but it was a complex one. I was like, oh, actually, we're going to need a couple more extra things. And here's why. They feel like part of the team now. And also, I don't have to worry about them knowing what I need. Like, maybe I'll need a stapler today. I don't normally have one. Just have that on hand. And here's why. And so I think doing things like that can also impart a sense of control and create the atmosphere. And then the last thing I'll say is I try to anticipate. I make it a game for myself. You got to know yourself. I love gamification, but I make it a game like, how many steps ahead can I run? Especially if I have a travel team. I always go try 3, 4. It's like the Wordle, like, can you get it in 2? Can you get 3? But I love like saying, okay, in about 30 minutes, I'm going to need this stapler. I'm going to need 2 loads, and just kind of like modeling that for trainees, but also it's a game for myself, and it makes the day pass a little quicker. And also it reduces that, time where you're waiting for equipment. So those are specifics that I would say help me with my sense of control.
Yeah, I think those are all excellent. And, you and I end up talking a lot about habits when we get together. And once again, another similarity, I do the same exact thing. I think it's really important to meet and speak with the patient the morning and the day of surgery. And everybody's going to have a different routine and different feelings about that. And we'll talk about patient sense of control and illness uncertainty and those kinds of things later. But I do think that's an important part of reducing the patient's uncertainty and giving them a little more control in the day. But I do the same thing. After I consent, I walk by the operating room and I talk to the team and I tell them what we're doing and I just check in with them and see how they're doing. And most of what I do is pretty standard on a day-to-day basis, but occasionally it's not. And it's just a chance to check in with them and say, hey, listen, this is what we're doing today. I think it's going to be straightforward, or I don't think it's going to be straightforward. What can I get for you? What do you need? And I think it's a great way to just tell your team that you're there for them, whether you want to call it control or just being a good colleague. I think it's an important OR routine that really does help with the team kind of atmosphere and working together.
Agreed.
Yeah. And then the last thing I was going to say, you brought up the travelers and how odd our ORs are now. And I was talking with my youngest daughter this weekend on the beach, and I know our youngest are about the same age. And my youngest one was very upset because we were at the beach, and this day she really didn't feel like getting that wet and didn't feel like getting sand on herself. And so this was actually a pretty deep conversation for a 5-year-old, but we sat there and we talked about, well, listen, if you're coming to the beach and you don't want to get sand and you don't want to get water on yourself, you're probably setting yourself up for a bad day. So if you just assume that you're going to get wet and you're going to get a little bit of sand on yourself, i.e. things aren't going to be perfect, you've set kind of proper expectations. And I've been working with a lot of colleagues on this. We see this now. I have an amazing colleague who just wants clinic to run smoothly every day, patient to patient. Every patient encounter, if they're 8 to 8:30, that's when they should be in the room. And I said, you're setting yourself up and everybody else for failure by making that assumption, right? Or setting the expectation that we're going to run like a assembly line. We're not. This is medicine. This is people. We're in a service industry. Things aren't going to be perfect. And if you set the expectation of perfection, doesn't mean not good service. We're giving great service. But if you set the expectation for kind of perfection on a time standard, then it's a lot tougher to keep that control.
Yeah, Phil, that is, I love the example, especially because I just got back from the beach and my husband was like, you will never live at a beach. Sand is, I'm with your daughter. I love the beach. I do not like sand, but it is deep. And I think that is so important because what you're basically saying is that the way that we think about our situation is going to create the experience we have, period. And there are so many ways you can think about what you're about to enter, whether it's a clinic or a OR or whatever the case might be. And you always have the choice to think differently. It's hard to do in the moment, but if you practice it over time, just like anything, just like the OR, you get better. I was thinking about, I know we veer off topic a bit, but I think this is like such a great example. I was in the clinic a couple of weeks ago, and it was one of those clinics that I looked ahead and I was like, wow, this clinic's going to be so easy. It's going to be so easy. This is the thought I had, right? And right away, I came to, I went to the clinic. My nurse is out, she's sick. And I have a new nurse who's never done clinic before. Like she's never even done Epic before. And, what am I thinking? My day's ruined. That's what I thought. I thought I had the perfect day. Finally, everything was perfect, and, but because I practiced this change of thought, as soon as I thought that, I was like, whoa, check myself. This day is going to be different, but I'm going to find a way to make it interesting. And that day, we were doing a selfie challenge, for the UNC, where you're supposed to take a selfie of someone and say why you appreciate them. And, I thought, well, I couldn't have done this clinic if this new nurse who had never done this, and probably scary for her, didn't show up and do it. I was like, you know what? I'm going to do the selfie challenge with her. We took a selfie, and I asked her, I was like, well, before we start, no worries. Like we're going to get through this today, no worries on that. We'll figure it out, because I could tell she's nervous. And then I was like, what, tell me about yourself. Like we've never met, or never really knew each other. And she told me the most poignant story. She was like she was like this high level executive. I did not know that. She's like, yeah, I threw it all away because I had this experience in the hospital. My son was really sick. It changed my life. I became a nurse. I had a second career, gave up a 6-figure salary and all this and that. I had no idea. I had like goosebumps hearing that story. It was the best day I've had in a very long time. But it's because at that moment, I changed my thought. And then that thought created a different action. And then boom, I had a great day, an even more perfect day than I had envisioned prior. So that is that control of my own reaction to a change in events. And that's going to happen all the time in medicine and in life. So I'm glad you brought it up, because I think that's critical.
Yeah, and at this point, I'd be remiss if I don't bring up Viktor Frankl, A Man's Search for Meaning, for any surgeon, any human being. I mean, this is a must read. It's a short book. It's an incredibly powerful read. 2 parts. The first is his experience in the concentration camps of World War II, and the second part is his psychiatric philosophy and kind of his evolution from Freud, which basically says, a lot of our distress in life comes from uncertainty or our inability to find meaning or search for meaning. But the most important thing he says is you can't, or the punchline that everybody talks about, not necessarily the most important thing he says is, we can't control our context. We can't control what's going on around us, but we have all of the control to determine how we react to that. And that it's an incredibly poignant point, and it's an incredibly poignant book. So I think it's really appropriate to what we're talking about today.
And it was my beach read. Can you believe it? I read it 4 days ago.
Oh, unbelievable, isn't it?
I know. It was a great book.
It's an unbelievable book.
I couldn't believe I hadn't read it yet. I highly recommend it.
Yeah. So one other, you brought us some really good OR points and things in the operating room. We talked about communication, being positive, giving yourself kind of prior examples, and your habits of kind of addressing the OR and the team. A couple other things I wanted to bring up and just get your thoughts on this. I do a lot of tough retroperitoneal cases, and anybody knows upper retroperitoneal cases or even pelvic cases, bleeding is not uncommon. And one of the things that we certainly have control over many of the time, not all the time, is kind of the pace of that bleeding and stopping a case and slowing things down. And I think that's one of the most important lessons I try to impart on our trainees and help our graduating residents and our junior faculty work with is you have control of the operating room. Most of the time you have control of the bleeding. Slow things down. Just put your hand on things, put pressure on things, give the anesthesiologist time, communicate, slow things down and put yourself back in control rather than accelerating through a tough moment in the OR. And I think that's an incredibly important lesson.
Absolutely. It's funny you bring that up because yesterday I said a saying in the OR that is exactly to this point. It's a Navy SEAL saying, which you might be familiar with, which is slow is smooth and smooth is fast. Meaning that, you know, when you do things in a slow, consistent, deliberate manner, it becomes smooth. And by doing it in a smooth manner, it actually makes the case go a lot faster than it would otherwise go. I couldn't agree more with that sentiment.
Yeah, I love that statement. Although there's one caveat to that, and I tell the trainees this too, is if you're going to do big cases and particularly big oncology, what we do for a living, at some point somebody's life is going to depend on you not only being good but being good and fast. So
Mm-hmm.
slow is relative, and you can make your slow faster through good practice. And so I teach our trainees all the time, and I do this too, is practice being faster when it doesn't matter.
Absolutely.
Close skin more precisely and faster. Don't just sit there and take a break because it's the end of the day. Close your fascia more precisely and faster. And that way, when you're on the vena cava or the aorta or one of the pelvic vessels and there's a problem, you can going faster or pushing yourself is something you're used to. And it's easy, not easy necessarily, but easier than if you've never done that before.
Yeah, and I think that lesson can be applied anywhere in life. When people tell me or you ask me my secret in getting things done quicker, it's that. It's just that I pay attention to the small moments. We forget those. We actually don't pay attention to them at all. You know, closing fascia and skin and all of those things that are so rote in routine. That's where we make up the time. But if you don't, and the same thing, you could say the same thing for calling patients after work or charting or anything, work or life. If you pay attention to those small moments, especially the ones that are routine, that's where you get most of your time back. That way you spend most of the other time on those hard things. You can actually slow down and use that time that you gained in all the other aspects. A minute here and there, they add up over the course of a day.
Yeah, and since this podcast is focused on mindfulness, I mean, listen, we're talking about being present, right? Being in the moment, whatever
Mm-hmm.
step of the case it is, whatever portion of your day it is, being fully present allows you to do that efficiently and quickly and move on to the next part of your day more
Mm-hmm.
efficiently and more quickly.
Yes.
All right, let's transition out of the operating room. Let's talk about control kind of in patient encounters and the clinic and just how you talk with people.
Mm-hmm.
We mentioned a little bit, or I don't know if we mentioned, but I was at least thinking a little bit of
Mm-hmm.
analogies with illness uncertainty
Mm-hmm.
for our patients. So let's start thinking about how we interact in those circumstances.
Yeah, so I think the first thing, and perhaps the most important thing I want to say about this is that what we think about our patients, we bring that into the room with us. You can say that you don't, but you do. Um, if you're frustrated with a patient, as professional as you might be, they're going to sense some of that frustration. It's impossible as a human to really hide that in its entirety. And I remind that myself that quite a bit. Going back to this mantra of the fact that the only thing we have control is over ourselves and what we're thinking, what we do. Um, I think about that a lot with patients, and I've experimented with it. And I would encourage anyone listening to do that, to really reflect on your experiences when you come in with an honest, authentic, positive view of that patient, and what happens when we have a negative view. Now, it won't always, it's not to say that doing that will always create the exact situation you want, because again, we can't control other humans. I wish we could sometimes, of course, just like everyone, whether it be my children or my patients. But we can't. But we can control what we bring into the room. It creates like an energy. And I know that sounds woo woo, but it's very true. And I think back. I don't remember all the specifics of this, but sometimes you think of examples where once I experimented, I remember this one time that really changed my thinking about it. I pre-chart, and that's one of the things that at least help me with my efficiency in clinic and getting all my charts done before I leave every day. Um, But I was pre-charting, and I hadn't seen this patient as a new patient. And with the pandemic, I'm seeing other kinds of diagnoses that I don't typically see. I had some feelings about that, but I'm still gonna, I've changed my thoughts. Like I think there are things that if I can help with it, I'm gonna help with it, period. And that has helped me. Now I read through this patient chart, and you can read some things like it sounded like a challenging patient. I read all of the notes from their primary care doctors, doctor shopping, and anyway, I definitely formed a negative view of that patient by reading all those charts, and I have done that before, and I think we all have probably. And at that moment, I was experimenting. I was like, you know what? Maybe I need to change what I think about this person. And I came into the room, and I hadn't quite, gotten there, in my mind, like thinking like this is going to be a great patient encounter, but it was already in my mind. I was thinking about it, and I still brought in some negative energy. But as I started talking, I was like, you know what? I'm going to just ask some interesting questions to me, like things that I'm actually curious about, like truly curious about, and see where it goes. And I'll tell you, it was like such a great encounter. That patient was nothing like the note said. It was just totally different. I had switched very quickly into thinking, like, and truly thinking, like, this is a cool person. Like, they've just had some, really big challenges in their life, and I can see why. And so I encourage, like, anytime I have a trainee in my clinic, I always encourage asking why to the patient, like, and being curious about it. Like, so there was like some things, like they left AMA once. I was like, I saw that you left in the ER. What happened? And I say it just like that. I don't say it judgmentally. I'm just curious, like, what happened to you? Tell me a little bit about that. And the stories I hear, I'm like, wow, that actually seemed like a reasonable thing. I may have done that too. But coming at that, that place of curiosity has helped me, at least, not all like put a label on that patient encounter before I actually even meet them. And then when I'm in the room, it's just such a, again, it comes back to our own experience. It's such a more pleasant experience for myself when I do it that way. So I would say, if there was one thing I'd say, it's that is really checking what your thoughts are before you enter that patient room, because you bring your energy whether you like it or not. If you feeling frustrated, they're going to sense that, and then they're going to respond in a way that's probably going to fuel your frustration. So
Yeah.
I don't know what you think about that.
No, I think it's excellent. And we've now started kind of a professional development and wellness curriculum as part of our routine grand rounds. And one of the first things we're going over is a Washington Post article that was published at the end of June. That's why if you saw me going off screen, I was reaching into my recycling bin. See if I can get it on screen here. I'll read it to you. There you go. Some doctors don't like some patients. And it's phenomenal. And it's about the negative energy that happens in it. And one of the things I love about this article is it says how to help at the end of the article. And there's a whole section for healthcare workers, which is basically goes over a lot of things you just said, which is actually really being mindful and present, doing the things you just talked about, being curious, giving people gracious excuses, being non-judgmental. And I think one of the really important things is just creating space, let people talk. That gives them back a sense of control. They can control a very uncomfortable environment for them, or what could be an uncomfortable environment, just by giving them the space to express themselves and tell you what they think is important. And then what I also love about this article is it tells patients how to interact and how not to interact, and how not to be a difficult patient, which can be challenging for some people too. But I wanted to bring up something else. You say, about setting the tone. And I think there's two really important things about that. There is a whole science about intention and purpose that we talk a lot about on this podcast. But one thing I don't think we have talked about yet is there's actually neuroscience behind this. We all have mirror neurons, right? These are literally hardwired into our neurology, into our brains, to actually replicate and do what the people we're interacting with are doing. So there's science here. If you bring negative energy into the room, negative energy is coming back out at you. If you bring positive energy into the room, if you're open and you're listening and you're creating space and being non-judgmental, you can expect the people across the room from you to smile, be non-judgmental, give space to you, and bring it back. So there is actually neuroscience to support these behaviors and to support the reasons why they actually do work.
Absolutely. I mean, I truly believe you get what you give, and in so many ways in life, and certainly in the patient encounter. And I was thinking, as you were speaking, some specifics that I've thought about over time. What do I want to bring to the encounter, and how, again, what do I want to give, and then get in return. I mean, again, I don't necessarily ask to get something in return. I just want a good experience for everyone. That's what we all want, of course. But I realize, what I want to give is I want to give a sense that I care, because I do care. I can't control, again, I can't control whether or not they feel that way, but I've experimented with certain things that I realize, this provides that feeling to patients. And but letting a patient talk, that has a cost. It does. The cost is time. We're busy. And I realized I was having this push and pull. I have a lot of patients to get through in a clinic, as we all do, but yet I want to hear them talk. And so I could think a couple things that came out of that is, and this cuts to back again, what do I have control over? Well, they're the choices I make. And remember, we probably have more choices than we even think we do. Sometimes, like how many patients I was seeing in a day at one point, it had become untenable. And could I do it? Yes, of course I could do it, but I was not creating the experience that I wanted, because I was rushing patients. And I noticed that over time. I was like, it took me time to realize it. It's like I'm rushing them, and I don't like that. I don't like that. And I would be apologizing a lot for rushing and all of that. And I thought, well, what if, I just take 2 off the day? That's it, just two, and just see how that felt. And, it was enough. It relieved it. And no one batted an eye. In fact, when I brought it up to our clinic director, he's like, well, we thought you were seeing too many patients, but we thought that's what you wanted to do. Like, again, I put it on myself, and we often do put it on ourselves. I mean, yes, there's productivity pressures, but remember that you still have control over that. But the second piece is really the interaction with the patient. Because, the first piece is like, what can I do within the constraints of administration and my clinic setup? But the second piece is like, how can you improve that interaction with the patient, but not rush them, right? Well, I realized over time, I was experimenting. I noticed one time a patient, it's just one time, and I was like, oh, that was interesting. I had said, and it was true, I prep my charts, right? I was like, yeah, I read that in your chart, a couple days ago. And they said, they paused, they're like, you're reading my chart 2 days ago? Like, that's awesome. Like, that I've never heard of, a doctor who did that or whatever. And probably doctors do it all the time, but it like planted a seed. I was like, that made them feel cared for. They felt that I cared enough that at a point where I'm not with them, I was spending time on them. And I was like, you know what? I'm going to experiment with saying that every time, because I do it. Why not say it? So I had that piece. I was like, okay, I'm going to experiment with that. The second thing is, because I prep the charts, not all of our patients are storytellers, or perhaps they're very long-winded storytellers. I'm actually a long-winded storyteller, by the way, if you can't tell. But in any case, so I relate. But how many times do we have like a story in front of us? We already know what we have read. But we do need the commentary. We need like some of the details that are missing, or sometimes it's wrong, whatever. So I started experimenting with this thing, which is now what I do all the time, which is I come in, and every time I obviously introduce myself, and they'd introduce themselves. But then I say, hey, before we begin, I was reading your chart earlier this week because I wanted to come prepared. People always, and I didn't want to waste any of your time. I want to spend most of our time on like discussing the solution to the issue rather than all of the details. So if it's okay with you, I'm going to read you the story. And I always say story because people love stories. I'm going to read the story that I've read through all of your records. And you're going to serve as my editor. I always say that. You're going to serve as my editor, and you're going to pause me. Anytime I say something wrong, or I have a detail that I've missed, anything, you just pause me. I just write it in here. That way we can spend almost all the time in discussing what your goals are and discussing how we're going to achieve them. And oh my goodness, Phil, that saved me so much time. I love that method so much, and patients love it. In my reviews, they always not always, but like oftentimes they comment on that piece of it, but it gets to the heart of the matter within like minutes. But then we start talk. I still have them talk, but I now have time for them to talk about their goals and like other things. And we don't waste the time, not to say there's wasted time, but there is some sort of wasted time when they're trying to like tell you a story. It's very complicated. And why should we expect them to be able to do that in a succinct way? So, I took that into my own hands, but then incorporating into that process has served me like tremendously well. And I'm happy about that experience. My patients seem to be happy. And, just finding ways like that, paying attention, experimenting, I think can get you to that point, but also reduce the amount of time that, you're in that clinic visit.
Yeah, I think those are excellent points. And I'll tell a similar, hopefully brief story. Um, we all get these kind of star ratings now, which I actually think are very important and appropriate. And a few years ago, one of my lower scores was on knowing the patient's history. And I was like, that's absurd. I know their history, but I realized we never really talked about it because a lot of what we do, it may not be so pertinent. And so it evolved. It helped me recognize that, listen, I need to address this with patients because they think it's an issue. And so it made me focus a little bit on that. And it changed my opening kind of spiel. And I do the same thing you do, but I do it differently. I walk in and I say, all right, let me tell you what I know about you. I don't explicitly say I read your chart, but I think it comes true when I start saying, you're so-and-so old. You had either a prostate cancer diagnosed because your PSA did this, or you had a kidney mass that was picked up because you had some belly pain or you were in a car accident. Your family history was this, your other medical issues are this. And I tell you, that's what I know about you. Tell me what I'm missing. And you see people go, oh, wow, this person actually knows who I am. And we can get right to the meat of it rather than asking, okay, tell me your medical history. Okay, tell me your surgical history. Did you ever have a cough or a sneeze? You know what I mean? You get right
Yes.
into the meat of it. And it's just a different way to do it. Just so our listeners here, there are lots of ways to do this. Find what works with your style and it works for you. But I think that's really important is don't go in and try and get the whole history. It's there for the majority of our patients. Tell them what you know about them. Impart to them that you spent the time to prep for them. And I think it makes a huge difference. The other way to do that, and we see a lot of patients that follow up too, right? We're cancer surgeons, and whether you're dealing with cancer, benign disease, or whatever it may be, you're going to have a lot of follow-up patients and established care patients. And sometimes those follow-ups literally could take 30 seconds. Right. If you think about the actual medicine that happens, it's 30 seconds of medicine. This test was negative. There's no evidence of cancer. I'll see you in 6 months or I'll see you in a year. But I learned from John Gerhardt, who's a great pediatric urologist at Hopkins, when it took 30 seconds, just sit there and ask about their family. Remember the things you know about. What's going on with the rest of your family? What's going on with your children? I know you're a huge, now that I'm in Philadelphia, you're a huge Eagles fan. What do you think about the Eagles game last week, right? It's an opportunity just to connect with them at a different level and show that you care. It costs you 2 minutes, 5 minutes, but it builds a tremendous connection with patients. And I think it's a really valuable little skill to help you kind of build rapport and longstanding relationships with your patients.
Oh, I could not agree more. For those who use Epic, there's like a yellow sticky note. I love the yellow sticky note. I always write in it because I realize, and you're right. It's great for the patient. I think they enjoy it, but oh my gosh, it's great for us. I mean, it's the humanity of medicine. I realized long ago, actually, that what I love about my clinic is that I have returns. I love the returns. I love knowing deeply about people's lives, and they know about mine too. I learned that, when I was pregnant early on, like especially when you're a cancer surgeon, they remember your kids' birthdays and how old they are based on when, you were, doing a surgery when you're 8 months pregnant or, whatever the case might be. And that's where it seeded for me, where I realized, it's a give and take, but it is a joy for me. Undoubtedly, I always make sure I have time for returns. I know that I still have to have news, and so there's a challenge there, right? But there's always a solution. I've started to, push those into virtual visits. You can do them much quicker in a shorter amount of time. And a lot of those virtual visits, we talk about exactly what you said about life. I learned so much from patients. Honestly, my favorite parts of the day are those moments where I'm talking about family and I have just a minute to sit And that is why when I told that story, I reduced that clinic load by just 2 patients because I didn't have time to do that anymore. And I realized very quickly that sucked the joy out of my day. If you don't have joy in your day, then okay, why are we doing this? Right. So I just could not agree more that, taking that extra time is great for the patient, but it is great for you. That is an antidote for burnout, hands down, in my opinion.
Yeah, great point. And I think, whether you treat cancer or benign disease, the whole reason we treat medical diseases is so that people can do the things they enjoy doing. So take joy in their joys, right? What brings them happiness? And then honestly, ride the wave with them and enjoy their happiness. That gives
Mm-hmm.
us great joy and satisfaction. And a lot of reason we went into medicine. I want to get into some of the practicalities of clinic because you talked about, knocking 2 patients off your clinic schedule.
Mm-hmm.
That's one way to do it. Now that I have a pretty significant administrative role, I work with a lot of my partners on how to streamline their clinic because there are people who struggle with this, and this is not easy.
Mm-hmm.
So some of the ways we've worked on this to kind of help people's clinic experience get more efficient, it all comes down to honestly getting rid of patients, but you can getting rid of the number of patients you see in a day and having more
Mm-hmm.
high quality interactions. And it
Mm-hmm.
depends on your practice, depends what you do. One of the ways to do it is get rid of a diagnosis, right? Limit a diagnosis or get rid of one that you might like, but it takes a ton of time, or maybe one you don't like, and see how that affects your practice. Revisit things in 2 or 3 months, see how that's influenced it. Depending on the data analysis and the data structure of your clinic and what your goals are, another way to do it is to look at surgical conversions, right? If you're really in a surgical practice, if there's a diagnosis that has a 10% conversion to surgery rate, that's probably a diagnosis you can delegate to either one of your non-operative colleagues or an APP who's kind of working up and managing patients. And while, yeah, we all wish we could see everybody every day, the idea is we want people operating at the top of their profession. And
Mm-hmm.
for most surgeons, they should be operating as much as possible. So that's another way to limit diagnoses. And then the last thing I wanted to mention and get your take on is the follow-up patients too, because we do love to see our follow-ups. It affirms what we do.
Mm-hmm.
But they also, when you get into a very busy practice, it can clog clinic, for lack of a better term.
Mm-hmm.
And so one of the things I've employed now is we built out a formal survivorship program. And once again, I'm talking in cancer, but this applies to benign diseases and others. And I tell my patients, listen, I'm going to see you once a year. In the
Mm-hmm.
interim, you're going to see the survivorship nurses and nurse practitioners and PAs.
Mm-hmm.
They're going to handle your cancer work. They're going to keep me in the loop. If there's any issues, I'm never far. But just with the volume of the practice, we can't see everybody at every single visit. And people are A-okay with that. You're still involved in their
Mm-hmm.
care. You still get to see how they're doing on an annual basis. And I try and do it on the anniversary of surgery because it's just a nice reminder. Say, oh man, I remember where we were
Mm-hmm.
last January. This was so different. And look how far we've come. And that's one of the way I've practically found to keep that interaction, keep that control over clinic, but not get overwhelmed in the volume. So lots of ways to do this. As you said, control and choices. There's lots out there, but there's some of them that I've come across.
Yeah, Phil, you always have great ideas that I take away from our conversations, and that is definitely one of them. I don't do it that way, but I love that idea, and I think I'm going to try it. I do, this virtual. It's sort of like a survivorship care, type clinic. And I do it like it's always the first Friday, or generally speaking, the first Friday of the month. I actually put on Fridays because it makes me so happy. It's like that. It's like I call it my happy clinic because everybody, has a cured cancer. We're just surveying for most of them, right? Of course, there's going to be a few that we have to have more difficult conversations, but in general, I know them all, and that's what I call it, the happy clinic, because I know their families, I know them. But I like this concept of maybe once a year, because as your practice expands, you have to pivot, you have to change, and that's, I think, what a lot of individuals, including myself, have forgotten is that it's not supposed to always be the same. You're it's just you are, yes, you're a living organism, but your clinic and your practice is living. It's constantly changing. You might change and start doing one type of operation. Maybe you are going to stop seeing a certain diagnosis. You're building your practice, right? Like there's so many things that are constantly changing over time, but it's so small and it's so imperceptible, you forget. And you don't realize you need to change along with it. You might have to alter your clinic a little bit. So that's why I have at least built in, I actually do it once a month, but I do a much more in-depth review of everything, like how I'm feeling about things at least twice a year. And that's a time where you should be honest with yourself and say, I'm not liking my clinic as much as I used to. Why? Again, so asking the patients why, ask yourself why, and like really think about it. If you do and you practice this why question to yourself, you'll eventually figure out what it is and then just figure out what you need to change. But if you don't build in time to actually reflect on it, again, these changes happen such in small doses, you will never notice. You'll just become more unhappy. So if you want to avoid being unhappy, then just build in a little time twice a year or maybe once a year even to reflect on what it is you're liking, what you don't like, and then change it up a little bit. Phil, I'm totally going to try this survivorship plan here that you
Yeah.
suggested.
Yeah. So we'll get to the control meetings in a second because that's something I've learned from you. And I do those at least twice a year now too. And I actually try and do them more often on a smaller scale. But the survivorship and the follow-up thing really works. But the key to that is really engaging and giving control, since that's our theme for today, to our APPs and our partners. And the way to do that is engage them. So we built the survivorship program and the algorithms with the APPs here. We are very clear with our patients that these are trained providers. They are our partners. They work with us and they are skilled and trained in your disease and your follow-up. And we are still involved in your care. And the reason we're not seeing you every single time is because we just can't. If we could, if we absolutely had the ability to, we would see everybody every single minute of the day, but we would get nothing else done. And patients are actually incredibly receptive to that. And so that's just a quick plug to really work your APPs, your partners, and engage them and build them in the process to give them control over it. And if you're not comfortable with the once a year thing, I have another partner. What we're working on is just doubling the interval. So instead of every 3 months, you see them every 6 months, but let somebody else see them in the interim. If it was a year, see them every 2 years. Whatever comfort level works for you, just basically work to expand that, and it'll give you more opportunity in clinic to spend quality interactions with people.
Absolutely agree. Yeah, we have the same relationship with our APPs. We have just tremendous APPs here at UNC, and so grateful for them. And it's the expectation setting on the patient's part. And I will say, like, the patients love our APPs. Like, I mean, they completely agree. So I think you're right. Like, remembering you have resources, and also that is part of what our job is supposed to lift other people up. And your trainees and your APPs, like, you want to give them that opportunity too. You don't want to take it all for yourself. It's, again, that surgeon sense of control is that we can do it best. That's not true. That's not always true. In fact, it's often not true. So just remembering, let other people, see your patients, let other people do other types of responsibilities. It doesn't always have to be you. And that in of itself is something to practice over time. And it does, like anything else, it gets easier the more you practice it.
Yeah, and I think the great analogy here is right in front of us. We mentioned this briefly before, but it's illness uncertainty with our patients. How many patients come into us so worked up about their new diagnosis or whatever disease it may be? And at most, half of what we do is in the operating room. A lot of it is just talking people off the ledge and giving them a plan. And you can literally see the anxiety come out of their face once a plan is in the place. And I mean, listen, in cancer, I'd love to hear your philosophy on this, but I mean, the more and more I treat cancer, sometimes I think the less and less impact we sometimes have on the disease trajectory. And that may reflect some of the bad cancers that I deal with. But the biology is completely out of our control, but the plans are not. And once we can reduce that anxiety for the patient and their family and give them a plan, once again, that sense of control is restored in a time where you have no control over what's going on in your own body. And I think that's the great analogy and thing to remember as we work through all of these interactions as surgeons.
Yeah, I think you said it so well, is that, what as humans, we really, most of us dislike is uncertainty. And I think when you have a patient in front of you, and I've asked, and so I speak from my own personal experience, but then I also speak from the experience of asking patients their experience. And it seems to me that oftentimes the hardest part in that, cancer trajectory is the time of the diagnosis, but before the plan's in place, because uncertainty is highest, even for a localized prostate cancer, when you don't know. It's so scary, right? And then you meet with them and you say, oh, this is likely curable. You even with active surveillance, right? Like, especially with that, right? You can go from feeling like you're going to die potentially from this cancer to being like, oh, I don't even need treatment here. But that uncertainty is often the hardest time for a patient in their, at least in their, and I like to ask, I'm just kind of curious, like after the fact, after they've been treated and even it may be cured, what was the hardest point? And it's almost always say that one piece of time where they had the diagnosis, but they don't yet have that plan. And we have a lot of control over ourselves of recognizing that anxiety, normalizing it. Everyone's feeling this way. I tell you, everyone feels like this sense, and just saying it out loud, like it helps in and of itself. Just recognizing that presence in the room, like that anxiety is the highest right now. And my job is to get that anxiety down as much as I can by coming up with a plan. And once we have that plan in place, most people start feeling better than they do right now. And I just say it out loud. Like I said, I share a lot, probably too much. But I just say it right out loud. And, I haven't had a patient who said they didn't like it. So I try to pay attention to that. But I think that recognizing that it can be therapeutic in and of itself.
Yeah, and I think there's a couple of other things we can do to reduce our patients' anxiety. One is scheduling appointments quickly, right? Keeping
Yes.
slots open.
Mm-hmm.
And I mean, there's some good data about retaining patients in a practice. And
Mm-hmm.
initially it was 14 days, then it was 10 days. And probably the correct number is if you can't get a patient in within 7 to 10 days, you're going to lose that patient to somebody who can. And not that's why we practice medicine or that's why we do surgery, but I think that speaks more to anxiety and illness uncertainty than it does about quality of care. Patients want to be cared for quickly. That anxiety is so tough on people that if we can't
Mm-hmm.
address their issues quickly, they're going to go elsewhere. And so to do that, you can create, there's lots of names from acute, urgent slots. You can keep slots open in your clinic that only fill within a week for patients who call in
Mm-hmm.
with a new cancer diagnosis or whatever the diagnoses you may see. That's one way to address anxiety. The second thing is I tend to address the big question right up front, before we get into, so I said, all right, this is what I know about you. And let me tell you, you are not going to die of cancer. Or
Mm-hmm.
this is really scary, but we've got a plan for you, right?
Mm-hmm.
And then get into the details. Just take the
Mm-hmm.
air out of all of that anxiety, and because it almost like you're building a story and they're waiting for the punchline. Tell the punchline up front. We're not telling a
Yep.
joke. We're not telling a story here. This is a medical plan. Give them the answer up front, and then tell them everything they need to know to get to that answer. I think that reduces a lot of anxiety. And then the last thing I tell people all the time, if my patients are listening, they affirm this. I tell them, listen, I can't promise you things are going to go perfectly, but we are going to take good care of you. We know what we're doing. We do this often, and we've got this plan in place and all the backup plans in the world if we need it. And that reduces a lot of anxiety for people too, or some message similar to that you know what you're doing. You're going to give them good care. You can't promise things are going to be perfect. I think those are all important messages too.
Yeah, I'll comment on two. I agree completely with everything you just said. I'm going to comment on two of the 3 points you just made. And the first is, having some slots for new patients, getting new patients in soon. I agree with that. I will also say that you have to be careful because you are a one person and you will not be able to see every single patient in a timely way. You just will not be able to do it. And that's okay. That's okay. Because remember, you need to bring your best self. If you are overbooking your clinic and not giving the time you need, and you can't even get them on the OR schedule, reflect on that. Maybe you shouldn't be seeing so many patients in your clinic. So just be careful. There's always a yin yang, like on these types of, dilemmas where you want to get patients in as soon as you can. At the same time, you're only one person and you have a finite amount of time. So just be mindful of it. That's all. Just pay attention. That's why there's semi-annual, annual meetings with yourself, so important. The second thing that I wanted to mention is you were saying like voicing that, fear, that anxiety right away. And I agree, that's important. I was thinking I also do that, not just with patients. I do the same thing for what it's worth, what are you scared of? And typically that's, with cancer, that's what they're scared of. Am I going to die of this cancer? Not always though. Sometimes it's a functional issue, like erections. Like I am so, this is so important to me, like everything, but I need to know that because I'm going to craft the entire conversation around it. So I talk
Great
about
point.
fears and goals of care upfront, because then I'm not saying again, wasting time, but I'm going to be able to very much hone my conversation, my discussions in a way that I don't have to revisit everything. Because remember that like whole concept of like your hand on the door and then you find out what's really going on. Well, like you have control over that in many ways, not always, but in many ways, by just again getting the punchline first and then using that to fuel the conversation. But I'll tell you another example where this is relevant, not just with patients. That's why everything we talk about is relevant everywhere in your life if you pay attention and you figure out where you're going to apply it. But whenever I'm on call with a trainee, especially if they're in like a new chief or a new, the first thing I do, I always talk with them, sort of like the OR concept, before the OR starts, I'm going to go in, talk to them. I do the same thing. Before we start call, I call them and I set my expectations like, I like to be called. Don't text me at, after 9 p.m. I go to bed early. I love sleep. That can be a whole nother podcast. But anyway, like, don't text me. I'm not going to wake up to it. Make sure you call me. Like just things that they'll need to know. So we have a really good week. But what I always end with, the question I always ask is, what are you afraid of this week? What is your worst fear? And it's so helpful to voice it out loud because then we go through it. I was talking to a trainee and I was like, what are you afraid of? What's your worst fear this week? And their worst fear was a trauma nephrectomy needs to happen. And they're like, and I just don't know if I have the experience to do it. And I'm like, okay, well, let's go through it. Okay. What would happen if that happened? And here's what we would do. And oftentimes you don't even need to do trauma nephrectomy, right? Like nowadays, like you can observe these and embolize and all this. But if really you are there, like who else is going to be there? Well, there's going to be a trauma surgeon. So if you feel like we need an extra hand, they're there too. We can ask them. We'll have blood in the room. We'll have this and that. Like it starts to dissipate, right? Like the fear, you're like, actually, I got this. We got this. We're a team. And then it's gone. And the funniest thing is this exact story. Guess what came in? A trauma nephrectomy. But it was so great because it was like we were all laughing because we were like, oh my gosh, can you believe it? We just don't get a lot of traumas at UNC, just virtue of like the who comes through the trauma bay. But it was just kind of a funny situation. But my point of asking that question is it's the antidote to fear is like you actually, it's just like shame and vulnerability and all that. You have to say it out loud. And it loses its power after you do that because you do have a plan. And once you have that plan in place, it gives you a sense of control. You never will have control, but you certainly will feel better in your experience of it. So that's one way I translate that patient experience, how I address that with like trainees. And then, I can also say examples other way, other places in my life. But remember that all of these lessons are applicable in many ways.
Yeah. Great story. I just want to make one comment, one exercise I do with junior faculty. And once again, this is going to be an oncology example because it's what I know, but you can see how this is applicable to a lot of things. But people will want to see every diagnosis they can, you know what I mean? Or every patient with a diagnosis they really care of. And the one example I always give is testis cancer. 9,000 men per year diagnosed in this country with testicular cancer. And it may be true that you do better at testis cancer than anybody else in the country. Given you may be the best testis cancer doctor in the world. If you want to see all 9,000 of those men, that's 25 patients a day around the clock, including weekends. That's just in clinic. Then you've got to operate on them. Then you've got to figure everything else out. It is impossible. And that is the most rare disease that we take care of, right? The numbers just scale up. You can't take care of everybody. You have to trust others. And so once again, relinquish that sense of control that you need to control every patient with the disease, control the patients that you can take care of and do a really good job for the people in your sphere.
Yep, absolutely.
Yes. So coming up on an hour, Angie, I want to give you the opportunity to steer this conversation in any direction you want. I don't know if you want to talk about control in your personal life or you want to talk about meetings, whatever makes sense to you as we kind of wrap up here.
Yeah, I think I'll say, I'll just speak to my own sense of control and how I try to create that in my life. And I don't say it to give examples, although, if people want to take away what I do, that's fine. But I really say it more as a high level, like of understanding yourself. What makes you feel good at the end of the day? There are some people who are okay not planning things, and that and they actually feel better about doing it that way, and that is fine. Know yourself, and then do that. I know I just feel better when I have things in order. Like I know what's coming up the next day. People who know me, and that's a whole nother conversation that we won't go into. I like bullet journaling. I like, having a schedule for the next day, understanding what I'm going to do. It's in essence, like maybe three or four things. It just helps me be more productive the next day. It also reduces a lot of my own anxiety. Because again, what makes you anxious? Well, then fix that. You do have the control to fix yourself. And that's what I focus on. So I'm not telling everyone to bullet journal. I'm not telling everyone to plan their next day. But for me, I think, having a sense of what's going to reduce my anxiety, figure that what that is for you. Maybe it's those things, maybe it's something else, and then do those things, or at least experiment with them, see how that changes your feelings of control. Because again, we don't have it, we can feel it. And if that feeling reduces your anxiety, it's what you're going for. So I would just say, my takeaway is that it's what I started with, which is most people like the sense of control. We do not have it, unfortunately. And the more you can understand that, the better, because it's setting up an improper expectation for yourself. But what you do have control over is yourself, what you're thinking, how you're feeling. It comes from your thoughts, and then what you do about it. And if you can harness that, your experience is going to be tremendously better. Why? Because of like mirror neurons, right? Like you feeling good, other people can feel good too. All these things that we talked about throughout the course of this hour. So focusing on yourself is probably the best investment you can ever make in creating this control. We're going to just call the word control in your life, and that feeling, that good experience we're all going for, whether it's in the OR or in clinic or in our home with our friends, wherever that is. It's all about paying attention and then making small changes and adjusting to create a better experience for yourself. And then everything else comes from it.
Yeah, I love what you said. I couldn't agree more with it. I'll just quickly summarize here, and then we can sign off and look forward to doing this again. But I'm going to start the summary with what you just finished with, which is knowing yourself, right? And you can only impart control if you know where you want to be and what you want to control. Like what's your end goal? What's your end game there? And I'm going to try not to get too Buddhist in our summary here, but I'll tell you a lot of the things we talked about control, about lack of control, about inevitable change, about imparting our feelings onto the way things act is very Buddhist in philosophy, and very Eastern in thought. And if anybody wants to read into those things or think about them, it's a great opportunity to kind of go down that realm. I've become unintentionally, but now intentionally, very Buddhist in my thinking about these processes and about how we interact with them. And I think it's incredibly helpful on a day-to-day basis. But we talked about choice, and we talked about control in a lot of circumstances. We talked about the operating room, talked about clinic. We talked about imparting control with our APPs and our trainees and call and all of these things that impact our surgical career and our surgical existence. And there were themes throughout them that I'm just going to kind of highlight: slowing down rather than accelerating, increasing communication, staying positive, interacting with an intention, and often a positive intention. When you're not feeling positive, reframe to kind of that positive energy, those positive thoughts. Talked about being curious, giving people gracious excuses, non-judgmental in the way we interact with each other, particularly with patients and the tough things that they may be going through. And then lastly, lowering anxieties, whether it's our own anxieties, whether it's our patients' anxieties, whether it's our colleagues' anxieties. Naming the issues, naming those fears or whatever it may be, can actually reduce a lot of the anxieties, impart that sense of control, and make our days and our lives and our existence as surgeons and humans, I think, much more tolerable and fun, which is why we're all doing this, right? We're supposed to have fun.
Absolutely. I think that was a perfect summary. And I hope that the listeners will get something from it. I feel so strongly about this topic because it brings me the greatest joy in my life. It gives me that experience I'm looking for. And I hope that the listeners can take something away to improve their own lives as well.
Well, wonderful. I know people are going to benefit from this conversation. So thank you so much for having it with me. And I look forward to seeing you again in person sometime soon, Angie.
All right. Thanks, Phil. Always a pleasure.